Okay, we are going to roll. Welcome, everybody. We gave it an extra minute or so because this is a national broadcast tonight. So our West Coast people are either watching this at happy hour or just finishing their last patient and scrambling to get on. So there are people just clicking on every second here now. So welcome. This is me. My name is Rick Mars. I'm your presenter here tonight. I'm coming to you live, virtually live webinar from Miami, Florida. I am an Invisalign provider, Invisalign exclusively. I am very close. I almost changed this to 1800 today. We're knocking at the door of 1800 Invisalign starts. That's the good news. The bad news is I only have 8 finishes of those, but really good at starting. I'm working on the finishing though. So that's the first bad joke of the night. If you laughed, it's good. So if you didn't, so you know, it is what it is. I'm on Align's global faculty, their national faculty. I was the educator of the year. I'm a Propel Key educator. I'm a proud alum of Emory University, and Emory's still there, but Georgetown University School of Dentistry is there no more. So there's no alumni donations to Georgetown, but I want to thank you for the great education. This is one of my biggest proud accomplishments. I came out with this book. It's called The Big Smile. And you're like, oh, big deal, big deal. He wrote a book. Who didn't write a book? Well, last week I hit #1 on Kindle in a couple of categories. #1 in dentistry, #2 in workplace management. So I'm really proud of my book. We released it during when's the greatest time to introduce a book? During a pandemic. So no book tour, none of that fun stuff. But we're not here to sell books tonight, but you can get that anywhere, Barnes & Noble, Amazon. But we were just #1 last week on Amazon Kindle, so that was really cool. Excuse me. This is one of my 3 offices, and this is what we do. We have 1 free day of dentistry. So when everybody says, oh, all they care about is money, well, yeah, we do care about money. We've given away $1,350,000 of free dentistry in 9 years. This is dentistry from our hearts, and our 10th year is coming up. It will be coming up later in the year. Unfortunately, we had to postpone it from our usual day right around Valentine's Day because of the pandemic. But obviously, this is a great thing. If you don't do it, please do it. It is the best day of dentistry. You will feel more gratitude in one day than you do the whole year long because our communities need this and we have to give it to them. So, look familiar? Is this coming to an end? We hope so. We don't know for sure. We don't know when. Obviously, with the exception of that Johnson & Johnson news this morning, we are trending in the right direction. We've yet to open our reception area yet. I don't know about you guys, but if it is open, I'm sure you're not packing them in like American Airlines, but you have them spread out and social distancing and being smart. But hopefully, these days are coming to an end. I'm looking forward to opening up my reception area again. Like I told you, I'm in Miami, Florida, one of the hot spots over the last few months, and we broke over 9,000 cases in my state today. So we don't see this ending real soon down here, but we're certainly optimistic and moving in the right direction. So hopefully this is not going to be something we know for a long time. But what's the result of this? Well, I will tell you, we're seeing less patients in our office. Do we have increased expenses? Sure. Have you bought a box of gloves lately? You know what's happened to that stuff. PPE, things like we've never had to buy before. Quantities of things, disposable this, that, whatever. By the way, if you want to know numbers, they said prior to the pandemic, and I cannot quote the source on this, but I heard this from one source, our expenses were approximately $15 to $20 to sit a patient in the chair. And now they estimate with disposables, disinfectants, all the things that we need to do, misting our room, so on and so forth. If you're doing UV, all those things, our expenses are now up to between $40 and $45 per patient to sit that patient's butt down in your chair. Everything takes a little longer. You know, you put on a couple of gowns, you put on a face shield, it takes longer to do. You know, what's happening with our visits? Do our visits up, down? What's going on with our patients? As far as our aligners and our Invisalign, are your starts down? Are your profits down? Well, I'm going to tell you, not bragging because I know I'm not alone, my starts are up. I'm knocking at the door for Platinum Plus provider again, which is like the 4th or 5th year now I'm hitting Platinum Plus provider. and profits are pretty good. I cannot complain. I believe we're very fortunate, but you got to do the right things to make that happen. It just doesn't happen on its own. So what's going to make you stand out? Are you practicing efficient? Are you giving a unbelievable patient experience? What makes you different than the grocery store? You're just slapping a thermometer on your patients' heads and come on in. And I know some places you really have next to no COVID, and some places you're in some of these hot spots right now. But what are you doing for that patient experience in 2021? So are you making your patients more comfortable? Are you working more efficiently, quicker? Are you cutting down visits for your patients so they don't have to come in as much, especially with your clear aligners? What are you doing differently now than you were doing a year and a half ago? Hopefully something. If not, after this webinar tonight, I hopefully will change your experience for you and your patients. So let's look at some numbers. The average duration of treatment for Invisalign and clear aligners, 20 months. The average number of appointments to complete that, 18 months. Let me repeat that. 20 months, average duration. Number of visits, 18. I know you say that's not you. You must be in there somewhere because these numbers don't come out of the sky. So what can we do to reduce treatment time? Who wins? You, your entire practice, your patients, everybody wins. If we reduce the number of visits, who wins? Everybody wins again. The patients, the practice, the doctor, everybody's a winner at the end of the day. You know, I make that joke at the beginning about my number of starts, and I joke about my number of finishes for a reason, because this is the name of the game. The name of the game is to finish. You can start all day long, but if you're doing refinements or additional aligners on 100% of your patients, I'm going to show you how that's no bueno. And if you, I don't care what, you know, I know there's doctors on here, and I know doctors who do only simple mandibular anterior crowding cases, but if you have to go into a second set of aligners, what you think is profitable is no longer as profitable as you think. And I have fellow colleagues, and I do some very difficult cases myself, but I have colleagues that are doing unbelievable cutting edge things with Invisalign. And at the end of the day, how much can you be charging your patients to do that work so you can get in and out of there efficiently so you can finish those cases? Because it's great to throw up slides at the end of a presentation and to run around the country like we all do with our decks and show everybody, hey, you know, look at this case I did, it's wonderful. But also put at the end, duration of treatment and profitability of this case. And I think people would be scratching their heads a little bit and go, yeah, it's not, it doesn't look exactly as exciting as I thought it was to do that case. So this is for everybody, this lecture tonight, because the name of the game, if you're doing simple mandibular anterior crowding or diastema cases or really complex cases, at the end of the day, the name of the game is to finish. So we have the exact same options of our specialists. Okay, we're using the same software, the same aligners. We can use all those adjuncts of like Propel and Munchies and all those other things out there. But what are they doing different than us? Are they more profitable than we are? Are they working more efficiently than we are? Lots of times, yes. Oftentimes, no. You know, there are different devices out there that you can use. Here's the first actual device that was created. This is the first aligner assisted device, okay? This was before Chewies and Munchies and all those other guys. This is real. This is one of my first Invisalign cases, and this was well before Chewies and Munchies. And this gentleman decided that to seat his aligner, he was going to cut an old tire. Okay, you can count the plies on that tire. All right, I think that's a 4-ply that he has there, but he actually trimmed a tire. I hope to God he cleaned it before he put it in his mouth, but as you can see by the color of his teeth, maybe not as well as we wanted him to do, but he used this to seat his device. And I can't credit this as the first aligner assisted device, but it's one of the first. And I don't encourage you to use this for your patients today or any day, but this guy did this on his own. Some things you just can't make up. So, you know, there's this thing out there, these direct to consumers, your Smile Direct clubs, and people feel that that's their competition and what's going on with them is affecting them. And honestly, I don't agree. Okay, I don't think you need to evaluate your fee structure. You can, but I don't think you need to. I think you need to embrace third-party financing. I think you need to be more efficient, and we need to educate our patients better. We need to let them know when we're working with companies like Invisalign, we're working with the #1 clear aligner company in the world that has invested hundreds of millions, if not $1 billion into R&D, and it is the best aligner company in the world that's using 2021 technology, not the old technology that these other companies are using today, all right? There are things that make Invisalign different, but you need to know that you have to become more efficient no matter what system you're using. And you can't be threatened by these direct-to-consumer products because you're better, and you have to know you're better, and you have to educate your patients so they get that message too. So the name of the game is clear aligners have evolved and accelerated orthodontics have evolved. And the name is people want to get these treatments done quicker in fewer visits. And it's up to you to deliver that to your patients. If you're not delivering that to your patients, if you're taking treatments that are taking 20 months to get done, 18 months to get done, that's way too long. So here's Invisalign. Like I said, the #1 clear aligner company in the world, 20 years of clinical use. Virtually any case now can be done with Invisalign. Almost nothing. There is almost no case out there that Invisalign can't tackle. And Invisalign's over 9 million cases worldwide. That's amazing. But who's our sponsor here tonight? Propel. They've been around quite a long time too. 10 years. You have 2 treatment options, in office and at home, and they're quickly approaching 1 million patients worldwide. So if you haven't heard of Propel before tonight, or maybe you heard about it whispered here and there, or at a meeting, or you saw a booth and didn't want to walk over, whatever it is, Propel's been around a long time. I've been doing Propel for a number of years now, about 6 years now. There's 10 years clinical experience, and we're going to show you the documentation here tonight, all the papers that have been written about Propel, and you have 2 options, one in office, one at home. So let's get into it. So this is not a bad word. This is why we go to work. I showed you about my 1 day that we do free dentistry per year. Well, 364 other days, we do it for profit. And we have to understand that cases are going to come our way just like this one. This patient's 23 years old. This is an 84 aligner case. 50 aligners to start, 34 aligners for our additional aligners or our refinement. That's a 33-month case. Can Invisalign treat this case? 100% absolutely. Do I treat this case, an 84 aligner case, in 33 months? No, 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 no. Why? I'm sending this case to the orthodontist. The orthodontist can treat this case if they choose to. They can charge whatever fee they want to do a case that's difficult. They can do it if they want to in wires and brackets if they want to, but I'm not going to treat a case for 33 months. I can treat 5 cases in that time, and I can't charge enough to the patient to justify a 33-month case, nor can you. So here's some guidelines. I say if you're getting above 35, 40 aligners, you decide you may want to consider referring that case out. Second, start more cases. Educate and scan every patient possible. Don't cheat yourself. Get better educated at Invisalign, get better educated at Propel, learn how to do more advanced cases, and don't be afraid to say yes to a case. But once you get above that 35, 40 aligner threshold, that's where it's time you might want to consider saying, you know what, maybe I'm going to refer that one out because it's not profitable. You need to improve your case compliance. That is the #1 cause of failure in cases is patients not wearing their aligners. What can you do to motivate your patients? Possibly charge them for their non-compliance, but also make up for the gap of their non-compliance with some of our auxiliary techniques that we're going to talk to you tonight about, like V-Pro from Propel. Once again, you can recover from that non-compliance versus going into refinement by superseding your aligners with a V-Pro, which we'll talk about, which I will do all day long to get the patients back on track versus scanning the patients and getting more free aligners. By the way, those aligners are not free. You do not pay Invisalign for additional aligners up to 5 years, but those aligners cost you a lot. If you're taking impressions, $25 per impression. If you're scanning your patients, you're taking attachments off, you're putting attachments on, You're taking your time to go and fill out that prescription again. You have to approve that prescription. There's a lot of things that go into those no charge aligners. So Invisalign would love nothing more than for you to get those done in one set of aligners, as would you, as would your patient, as would your team. So whatever tricks or tools you have to use, such as V-Pro to reseat a case that's not completely seated, use those tricks, and that way you will stay more profitable. And we're going to talk about that a little deeper in just a couple minutes. So, are these worth it, these adjuncts? Is Propel worth it to you? Well, if you're doing a dental procedure that's netting you $400 profit, and it's 10 visits to complete that, is that worth your time? You're not even covering your nut from your sterilization, seating the patient in the chair if you're only making $40 a visit. So you need to stay much more profitable than $400 if you think that's how you're going to make a living at the end of the day. So let's look at the numbers, because the numbers do not lie. So this is based on a national average, $5,800. That includes Vivera retainers, 4 sets of Vivera retainers. So that's an average case. Align's fee is netted down from $829 to $1,800, and the $275 Vivera is netted up from $275 to $300. So that's a wash right there to a $2,100 total lab bill. So you take $2,100 away from $5,800, and that gives you $3,700 gross profit. Now, how long does it take you to get that case done? If it's 5 visits, it's pretty profitable. If it's 10 visits, it's respectable. You start getting up to 15 visits, your profitability is a third of what it could be, potentially. So you have to understand these visits, your time, your butts in the chair, cost you money at the end of the day, and you cannot ignore that. Now, we're going to introduce V-Pro into the case. If you introduce V-Pro into the case, and we'll show you exactly what that is shortly, the cost for one V-Pro is $449. You can get those costs way, way, way down when you buy these in bulk. So it's up to you to determine how many you're going to buy, what your cost of the V-Pro is. But guess what? You can knock out visits with the V-Pro. So you're almost not going to see a 15 visit case at this stage of the game. The worst you're going to see is a 5 or 10 visit case, and therefore you stay relatively profitable by introducing that lab bill of V-Pro into your overall costs. A lot of people get dissuaded by this because they're like, I don't want to pay hundreds of dollars for an auxiliary. Well, if you're saving yourself additional aligners or refinement, that's what it's all about at the end of the day. Even one V-Pro, which is the highest price V-Pro, it's going to save you hundreds and hundreds of dollars in every single case at the end of the day. That's what you're not understanding if you haven't done it yet. So now let's do a case fee, and we're going to include retainers and Propel at the end of the day. What happens there? Okay, so our case fee, we charge $600 now more for our Propel, because we know we're going to need the Propel at the beginning of the case. We're charging for it at the beginning of the case, and look what it does to our profit. Let's go back a slide. Oop, I went the wrong way. Work with me. Hold on. So this is where V-Pro is introduced but not charged, but now we're going to charge for the V-Pro. And if you want to focus on that 5 visit case at the bottom, you're at $650 a visit. If you charge $600 for your V-Pro, your profitability goes up $120 per visit. So it's very, very simple when you see you can charge for this device if you choose to. Some people include it. This is personal preference. But at the end of the day, if you charge for it or you include it, at the end of the day, it's going to shorten the duration of your cases, make your cases more predictable, keep you in one set of aligners versus 2 or 3 sets of aligners, and therefore you're going to be profitable at the end of the day. Now, let's look at the numbers. Again, you saw this earlier. This is potentially the most profitable procedure in your office. I know people come back and say, well, my implants I charge, $8,000 for, more profitable. Well, I don't know about that. But per hour, this is the most profitable procedure in your office if you do it right. If you get it done in one set of aligners, which should take you 2 to 3 hours, you're looking between $1,200 and over $1,800 profit. Now, what happens if you have to do additional aligners? Those ones that Invisalign doesn't charge you for, that doesn't cost you any more money, all those numbers are the same. Now the case takes 4 to 5 hours. What does that do for your profitability? It cuts it in half. So now we're not looking at $1,200 to over $1,800 per hour profit. Now we're looking at $740 to $925 an hour in profit. So those additional aligners cost you more money than you ever imagined they would. So it's vital you understand what appears as free is not free at all. And when your assistant has to go take a couple more impressions, sets of impressions at $25 impressions, you could be into another $100 or $200 of impression material alone. You never know that, Doc, because you don't order that. You just pay the Henry Schein bill. You don't know how much your assistant's going through in the back while she's gagging Mrs. Jones taking those impressions. So hopefully you're using iTero scanners, and that will save you at the end of the day. So here's your answer. Okay, this is it right here. The vPro Plus, that will 5 minutes a day. If you want patients to use it twice a day, it's 10 minutes a day. It is a mild, high frequency vibration. The patients hardly know it's there, but it gets the job done. If you want to do something in office, here's our in-office solution. Okay, this is also offered by Propel. It's called micro-osteperforations, MOPS, and we stimulate the bone by taking a 15-minute appointment, usually one time in the entire treatment. That therefore the patient doesn't have to take home a device and use it. This is done in office. And either one of these solutions, the at-home solution or the in-off solution, provides great results to keep your patients in one set of aligners. So here's the high frequency vibration. It's what we want to refer to as our first line. All right, it's up to you. It reduces office visits. It improves your predictability, reduces patients' discomfort. You can accelerate tooth movement. If an aligner is not seating properly, we can super seat that aligner if you have some aligner gap, if you will. You can also recover from lag. If you haven't seen the patient every 5, 6 aligners and they come in and you're like, we got to get caught up on tooth number 23 is a little bit rotated still. It will help you recover from lag, and it'll also help you recover from relapse and retention, which we'll show you shortly. It's a 5-minute cycle, shuts off out automatically. It is easy for the patients to do. They can do it at home watching television. They can do it while they're driving. Virtually any time of day, they can use this. This is the in-office solution. This is Propel. It creates MOPS, and it is what we're going to call our second line. Can you use it in conjunction with the vPro? Absolutely. All right. Yes, you can use a hand driver, or you can use this automatic driver if you choose to. It's about a 15 or 20-minute procedure. You numb the patient in the office. Like all procedures with aligners, we don't want anybody using any aspirin or Advil or any of those NSAIDs afterwards, because it works against our inflammatory process, and we want inflammation when we're removing teeth. So if you're using any of these devices, or if you're not using any of these devices, your patient should know to avoid aspirin, Advil, Aleve, or any of the NSAIDs. Also, because this causes the density of the bone to temporarily decrease, it reduces the possibility for root resorption also. So there's a lot of benefits to either of these techniques. They've been around a while in terms of the science on them. Many of you have heard of Orthodontics, which is a very aggressive technique to stimulate bone. But way back to 1892, I was not there, but Dr. Bryan introduced corticotomy cases. All right, and in 2010, Propel was introduced because it is a much less invasive than Orthodontics, and there's just over 600 peer-reviewed clinical trials on perforation, on MOPS, on corticotomy. I said that so bad, I'm sorry. Science, but it's all there if you want to read the science. It is nothing that came around yesterday. The science is there to back this up because it works. Many of you haven't seen MOPS. Many of you have heard about MOPS, or you're on chats with MOPS. This is what a MOP looks 5 minutes post-op. That's it. Bleeding stops. Those holes close up on their own, but you have to understand a MOP is very, very different than a hole in the bone. And I urge you, if you get nothing off of this webinar tonight, then, I'll make my own MOPS with a high speed or a slow speed or anything similar. Get that here tonight. This is not done with a burr. This is done with a very special patented device. There's no danger to root anatomy like there is with a burr. There's danger of heat necrosis with a burr. There's surgical irritation with a burr. There's soft tissue trauma with a burr. It removes bone. It's not a micro crack when you use a burr. Ladies and gentlemen, I've been practicing for over 3 decades. I know you're looking at me now and go, damn, he looks good. All right, but I can tell you one thing. You want to avoid the big mistake. And this would be the big mistake. You may have done this before. You may have think you're successful before. But when you have a problem and you want to defend this in a court of law, that you drilled a hole in the patient's jawbone with a high-speed drill when there is mops out there that's done with propel, just pay whatever they're suing you for, because you're going to lose that lawsuit. No doubt about it. So this is the first and only device cleared by the FDA for use with mops is propel. Anything else is going to get you in trouble. If you're afraid to spend $100 to bring your case to successful conclusion, I'm sorry if I offend you by this statement, but you are in the wrong business. All right, do it right, do the right things for your patients, and you may have pulled this off once, twice, 5 times, 10 times, but wait till you catch a root, or wait till you cause heat necrosis on that bone. When you have the problem, it's going to be a big, big problem, and you're going to wish you never cut a corner, saving 100 and change because you didn't want to spend the money on propel. Do it the right way, and you're going to stay out of trouble. So mops are easy to learn and quick to perform, but they're often misunderstood. It is not creating a hole. No, it's creating compressive stress. That's the difference, and this results in a change in bone chemistry. Compressive stress create radiating micro cracks, and that's what it's all about at the end of the day. Remember this slide back in biology? Osteoblasts make bone, osteoclasts eat bone away. Well, when we put aligners or braces on teeth, we want inflammation, because inflammation makes cytokines. Cytokines result in osteoblast, osteoclast activity. That's bone remodeling and tooth movement. When we introduce MOPS or VPRO into it, we do the same thing, but we put it on steroids. We amplify it. We don't put it on steroids. That's a figure of speech. We want that inflammation to happen, and we want it to happen at the highest level so it's more predictable. You want to have the osteoblast, osteoclast activity, and when you introduce MOPS or VPRO into a patient's case, then you are going to be introducing an amplified inflammatory response, resulting in a higher cytokine activities, more activity among the osteoblasts and osteoclasts, and that's how you're going to get more predictable, less dense bone, where you're going to get that more predictable movement, in the less dense bone. Here's the studies, Harvard, NYU. These are actual studies that have been looked at in relation to osteoclast cell activity. When we use a VPRO, our osteoclast cell activity increases along with orthodontic force approximately 5-fold when you introduce VPRO. You're going to have better seating, you're going to have better circulation simply with that high frequency vibration. It's that simple. 44% less discomfort the first 3 days of a new aligner when you're comparing an aligner with or without VPRO. And if you want better movement, look at the 7-day movement with VPRO on the right. That is going to give you 90% aligner tracking if you're using VPRO and 7-day aligner changing. This wasn't invented yesterday. We are currently on generation 3. It has Bluetooth compatibility, bigger battery, USB-C charging, and we have a ready-to-use app with VPRO compliance, aligner compliance, remote monitoring progress. Photos are also included for free. So there are great advantages, great app with the Propel VPRO. So it's up to you to use it, but we're now on generation 3 and it's gotten better and better and more comfortable. And I will tell you, my patients love it. So those of you who are not doing 7-day aligner changes, shame on you. I had a patient in today who's seeing a local orthodontist and one of the most prominent Invisalign orthodontists in the area, and she's doing 14-day aligner changes on a basic case. And she asked me how many I'm doing, and I was embarrassed to tell her she could have been done in half the time if she did it with me, and I would have used a VPRO on her and she would have had a lot more predictability. But if you notice the small print at Invisalign's handout, it notes this is at the doctor's discretion, that you should monitor tooth movements, the more difficult ones like rotations, extrusion, significant root movements, those blue and black movements. And depending on the patient's response, particularly older people, consider longer periods between aligners. So it's up to you at the end of the day, but in most cases, 7-day aligner changes works. And if you haven't heard about Invisalign's new G8 features with our new Smart Force technology, now Invisalign's able to attack crowding and cross-bite cases like never before, deep bite cases like never before. So the message here is Invisalign's doing more and more and more to make Invisalign more comprehensive. And they want you, after you've been doing a few hundred cases, they want you to get off of those mandibular anterior crowdings and do expansion cases and do things that might improve your patient's airways and a lot of the cutting edge things that are happening out there right now with Invisalign, that you should have the confidence out there because Invisalign's gotten better, but sometimes you have to have those adjunct services, and these are your adjunct services. When you introduce V Pro into the game, you can change aligners very predictably, blue and black movements in 7 days. Some people allow it to go in 5-day. I'm pretty good in 7-day personally myself. 5 minutes a day. My patients want to use it twice a day. I'm happy to let them use it twice a day. It's not going to hurt them. And then it's up to you. How often are you going to see these patients? Do you want to see them every 12 weeks with that first set of aligners? If they're into a bigger refinement stage or longer, some doctors stretch it out as long as 16 weeks. This is your call, what you want to do, but you will see your patients will have much better compliance. If they don't have compliance, they're going to look like they have better compliance because they're using V Pro, which allows those aligners to stay seated on those teeth and do what they're supposed to do. So I am using V Pro virtually on all of my cases right now. Some I charge for, some I don't charge for. It all depends on the difficulty of the case. But I know at the end of the day, if I'm charging for it or not, I'm going to profit. I'm going to have a higher profitability knowing I'm having one set of aligners versus 2 or 3 sets of aligners at the end of the day. So what are our benefits? Reduce visits per case. It adds value to your treatment. It sets you apart from that person who they've gone on 3, or 4 consultations already. You're the only one who talked about this device, this V Pro, and then you show it to the patient and it's very benign looking. Oh, I just have to bite on this 5 minutes a day and I can do 1 week aligner changes. I'm going to be done in 6 months or less. It's amazing. And you know that if they're not giving you the full 22 hours a day, if they're giving you 18, 19 hours a day, 20 hours a day, this is going to help compensate that. Okay. So it improves that patient experience. It reduces the need for refinements and that extra treatment time. We don't want that extra treatment time. I'm going to stress over and over and over. It is not for free. You don't pay a lab bill for it, but it costs you at the end of the day. So here's the question. Do you include it with the treatment? Do you just throw it in there knowing, you know what? Mars just showed me I'm cutting my profitability in half. Do I want to spring for $449, just give it to the patient, or do I want to charge the patient for it? So the question is, if you charge, how much do you charge? So the average charge runs between $400 and $700. Again, if you buy these in bulk, you can get the price way down on them significantly, and you're going to talk to your territory manager. They will be in touch with you, and they'll let you know how much they are in bulk. But you decide what you want to do. If you're going to upcharge for it, then it's no expense to you. If you want to include it in the cost, that's your call, what you need to do at the end of the day. But you're going to see, and I'll show you a couple cases soon, that this is going to allow you to do much, much more difficult cases that you never envisioned, never imagined that you would be doing. You're going to be doing now. Now, here's a crazy thing, okay, that high frequencies identify a dual mechanism of action. So when you're in the retention phase, think about this. What you don't want low bone density in the retention phase. You want that bone density to start shooting up, okay? You want that bone to start filling in. You don't want that osteoclast. You want that bone to be filling in, and you don't want it to be eating away. You want increased bone density. Well, guess what? When you're using V Pro and there's no orthodontic force put on the patient, the bone density increases and helps you in retention, just as it helped you with tooth movement when you had orthodontic force being placed on the patient. So when you're in active treatment, you want the bone density to go down, you want increased inflammation, but when you're in retention, You want the bone density to go up, inflammation to go down. And this V-Pro with high frequency vibration gives you both of those mechanisms in one device. That's amazing. So there's studies out there. You can look up about the anabolic and catabolic effects that go on with vibration in orthodontics. As you see the first article here, the conclusion is vibration can be utilized to accelerate the rate of orthodontic tooth movement during the catabolic phase of treatment when we're moving teeth, and subsequently be utilized to accelerate retention remodeling during the anabolic phase after orthodontic forces are removed. So here's numbers. 40 to 90% of orthodontic patients relapse within 10 years post-treatment. Why? Look at the other numbers. Periodontal tissue takes up to a year to remodel on average. Bone density can take up to 2 years to recover after orthodontic treatment. So you have those patients come back in who go, whoa, 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 wait a second. My teeth are moving afterwards. Oh, you're not wearing your retainers. I wear them every night, doc. I swear to God, I wear them every night. Why? Because that bone hasn't caught up yet. That bone density, you still have mobility of those teeth, and 40, 90% of those patients are relapsing because their tissues have not recovered. Their perio tissues haven't recovered, their bone density hasn't recovered, and it's up to us to provide something to our patients so we allow that bone to catch up after all that tooth movement. High frequency vibration does that. Hard tissue, 37% increase bone density during the remodeling period. Soft tissue, 125% increase PDL fibroglass happens when you use the V-Pro in the retention phase. So here's your recipe in terms of retention. We want to wear those retainers full time for 90 days, and then we want to use that V-Pro 5 minutes per day. How long? You want to hedge your bet? I would say 6 to 12 months, have the patient use the V-Pro for 5 minutes a day. They paid for it, it's there, they have it. It's only going to help you increase the bone density. So if you're looking to hedge your bet, not have any fallback in terms of your patients, in terms of having that bone remodel appropriately, 90 days full-time retainer. Every night after that, you're going to switch to it, and that V-Pro, I say 6 to 12 months afterwards. So we all agree the toughest teeth movement with for a GP with Invisalign is obviously the maxillary laterals. What's number 2? The maxillary laterals. What's number 3? Maxillary laterals. You know that, you've seen it. Maxillary laterals are the most difficult tooth movement in Invisalign. Why? Combination of things, small surface area, long roots, and you should know that Invisalign has more combinations of attachments for lateral incisors than any tooth in the mouth. So Invisalign knows it, you know it, I know it. This is the most difficult tooth movement in the mouth, and we have to do everything we can to keep the aligner tracking, fitting on those lateral incisors. So seriously, what do we find the toughest movements? Like I said, maxillary laterals. How about extruding a canine? Mandibular incisors, those little guys down there, rotating them. Crowding or spacing cases greater than 6 millimeters. Rotations greater than 40 degrees, and basically all those blue and black movements. These are your tougher movements that we have with Invisalign. They're not as predictable. They've gotten a whole lot better over time, but they are tough moves, and we need a solution. We need something we can do to handle these difficult movements. Not every movement is 100% predictable. Patients get older, they have denser bone, they're harder to move teeth. How many of you know orthodontists that only treat kids? Do you know why? They don't love kids that much. They love kids' bones because those teeth move beautifully through that soft child's bones. You get to adults, you get to a 60, 70, 80-year-old, how dense is the bone in the mouth? You need something to level the playing field. So let's look at some cases. Okay, here's a case study with Propel. Class 3 molar relationship, midline off, severe crowding, tooth size discrepancy, clear aligners, 1 mop application. This case was done in 7.5 months. 7.5 months, 1 set of aligners. Next case, Class 1 Division 2, 1 mop application, 19 aligners, 5-month treatment. My top 2 favorite all-time cases. 43-year-old man. Look at his face. This is 6 months later, and he didn't put on any weight. That is all his jaws. 1 mop application, 24 aligners. Look at that case. Changes his smile, changes his face, changes his attitude, changes his personality. Didn't change his love for his phone, though. Still has that in his ear no matter wherever he goes. 43 years old. Beautiful case. Next case. That's him, rather. I'm sorry. How's that? Next case. Open bite case. 33-year-old female. 10-month case. 8 visits. 47 aligners. 10 months. Beautiful results. Second favorite case. First favorite case, rather. You saw my second. 30-year-old female, 6 visits, 30 aligners. Game changer, 7 months. V-Pro, 5 minutes a day. Expansion, maxillary IPR. $30 aligners, V-Pro. So question for you, can you do this? 30 aligners, no refinements, can you do that case? Get those results? Change a patient's life? Smile, same outfit, different hair, smile. Look at the difference on how she smiled from the left to the right. Look at her changed her face. Can you do this? Yes, you can. How? Right there. That's the magic. So you have problems, you have solutions. There's nothing like having problems with no solutions. It's even better at problems and you have the solution. The solution is right there, the V-Pro. I'm going to give you one little pearl tonight because I love to share pearls, because whenever I do a webinar, I'm like, okay, he's pushing those V-Pros and I get the message I need to get a V-Pro. So here's your gift, okay? I call this the Mars method because one day I want to have something named after me. So I do 7-day aligner changes for virtually every case. Gives me the best tracking, best comfort, fewest refinements. Monday is the day that all my patients change their aligners. How do you do that? Well, if we delivered a case today, we don't let them change in 5 days. I'm sorry, in 6 days. We make them change their first aligner in 13 days. We want everybody changing their aligners on Mondays. Why? Because it's a fresh week, a fresh aligner. People are more compliant during the week. All right, I know people aren't going out as much, but down here in South Florida, a lot of people are going out as much, but people will start going out more on the weekends and are starting to again. But those are the worst times for compliance. They're out to dinner, I took them out, I was with friends, I had a couple of drinks, and the aligner is out 3, 4, 5 hours. Maybe they fell asleep because they had more than a couple of drinks. So we change aligners on Monday. That gives us Monday through Thursday maybe. And, you know, in terms of maybe your Monday through Friday for highest compliance. And if they're a little sloppy on the weekends, you know what? Most of the work was done Monday through Friday with our V-Pro. Saturday and Sunday are virtually those days of just kind of give me the best you can. I don't tell them this, but I know that. So if they're going to change aligners, if your patients change aligners on Thursdays, guess what? You're good for 1 or 2 days of solid compliance. but it's a recipe for refinement if you have your patients changing aligners on Thursday or Friday. What I do is I have them change on Monday, I have them use the V-Pro, and that's my recipe for success. And if you want to become an off the charts, amazing, deliver amazing service, and this is what I talk about in my book, The Big Smile, you want to deliver amazing service, have your assistants call your patients, every single one of them after that first aligner, and check in with them and say, hey, we're just calling you, we're making sure you know that tonight's your night to change your aligner. Are you having any problems? Are you wearing them 22 hours a day? Are you only wearing them 20? You need to wear them 22 hours a day. And they hammered home. And that's what it's all about at the end of the day. You must get your patients to be compliant. And if they're not 100% compliant, you must use the tool available to you, V-Pro, to keep them on track, keep those aligners seating so you are successful and you get done in one set of aligners. Let's bring it home.
An elderly woman goes to the dentist, and the dentist says she needs Invisalign. She says, but what if I die tomorrow? Suddenly she hears this booming voice, and this voice says, you're going to live another 20 years. She's okay, great, I'll get the Invisalign. After the treatment is over, she walks out the door, gets hit by a car, goes up to heaven. God, she says, you told me I was going to live another 20 years. He said, I'll tell you the truth. I didn't recognize you.
82 years old Invisalign patient, ladies and gentlemen. So we're going to open up the questions. We have a few minutes to do that. You can type them into the question section. I will do my best to follow along here. If I screw this up, I apologize. Let me expand this out. Okay, regarding insurance companies' claims, are MOP procedures considered the same as alveoplasty? I'm going to tell you it depends on the insurance company, but you can submit this to your insurance company. Yes, that is something that's possible for you to do. I'm not an insurance expert. I'm not going to lie to you, but I know we have submitted some claims depending on the insurance company. Don't ask me who, but we have been successful doing it with some of our insurance companies. When using MOPs, do you do at the start? How do you know if you need a second round? Okay, so yes, I do it at the start. You know, this is a, do you like chocolate or vanilla or swirl? So I'm a big believer in jump in, get the case going. You know, other people are like, oh, I give them the aligners the first time and then I have them back a second visit and do the MOPs. If you choose to do that a week later, just so you want to get them started wearing the aligners, that's one way to do it. But I do it at the start. I wouldn't put it off well into the treatment. If you're going to put it off at all, I'd put it off 1 week at most. Just let them wear their aligners for that first set of aligners and see where they're at. As far as how do you know if you need a second round, it depends. If it's a 20 aligner case in the ballpark of 20 aligners, 24, 26 aligners, a 6-month case, one set of MOPs is good for me to get the case going. The only time I'll do a second set of MOPs, if for some reason I do, and let me make it clear, it's not like I never have to do additional aligners. But if I have to do a second set of additional aligners, I may introduce a second set of MOPs into the additional aligners, depending on how much movement is necessary. Okay, we don't like crickets, so if you have any other questions, type them in. So one of the questions that we get a lot, and I'll give you the question, is I know you're about to ask it, when MOPs, when vibration? So that's a good question. Sometimes if it's an isolated area, you know, I showed you the case with a gentleman who you saw literally, I said he didn't put on any weight in his treatment. That's literally what his new face looks like once we expanded him. He was a guy who I was just happy to have compliance wearing the aligners, and he was good wearing the aligners, thank God. I didn't want to introduce anything else into his case, and I wanted to ensure that we were going to get that movement. So he's a case I decided to do virtually his entire mouth with MOPs. Oftentimes I'll do mops where I have an isolated area that I'm working on, and say I want to focus on a difficult rotation or extrusion, I'll use the mops in that area. Sometimes I use the mops along with the V-Pro together. So, but generally my go-to is using the V-Pro vibration. Patients don't mind it. 5 minutes once or twice a day works very well. Do you use the V-Pro with the aligners in or out? In. Absolutely, you must use it with the aligners in. It's very, very important that they do that, because if they don't use it with the aligners in, then you're not going to get that effective seating the aligners, giving them the comfort they need. So you must use it with the aligners in. Jim, good question. I have a patient with extruded lower anterior teeth. The V-Pro will only hit the anterior when in use. What do you do in these cases? I have a patient with extruded lower anterior teeth. I'm a little confused by your question, Sarah. If you could give me a little more information. So you're saying basically the curve of speed, those teeth are sitting like in a deep bite. Is that the question that you're saying, Sarah? If you can clarify that. There is flexibility with the V-Pro. So it's not, they can get the teeth all don't have to be in the same plane of occlusion. So if that's what your question is, yes, a deep bite. So you don't have to be in the same plane of occlusion, where they're getting the vibration. That vibration is transferring throughout the jaw, not just where it's hitting those teeth that are sitting up in a deep bite that are extruded. So you're still getting the full effect with the V-Pro. And as those teeth get seated and that deep bite is corrected, make sure that you are also using bite ramps, Sarah, on those cases. Lots of times, a lot of doctors don't know. They're not put on automatically. You have to ask for bite ramps in your prescription, and that will help you along with the V-Pro to correct that deep bite. Also, those G8 attachments are also really good in helping correct deep bite too. So you got a lot of things going in your favor if you're working that case right now. Can you use the V-Pro with a removable palatal expander? Sure, you can. You can use it with fixed orthodontics too. Absolutely. Answer your question is, doesn't matter how the vibrations transferred throughout the aligners is exactly what I told you. Somebody chimed in and helped me out there. So you don't have that problem if you have some teeth that are not in the plane of occlusion. You recommended no NSAIDs for V-Pro and also for MOPS for the entire treatment time. No NSAIDs or aspirin for any aligners at all. If you use MOPS, if you use V-Pro, you want to keep the inflammation up, not down. Aspirin, NSAIDs are anti-inflammatory. We want that inflammatory response going on, especially when we introduce MOPS, especially when we introduce V-Pro. So no NSAIDs, no aspirin, Advil, Aleve for clear aligners, period. Especially clear aligners, period, comma, especially when using MOPS or V-Pro. In order to get a higher percentage of claim approval for a veoplasty treatment from the insurance company, can you share with us points or notes that we can add to the narrative prior to sending the claim? I'm going to have a little difficulty answering that question because I think it is particular, and if anybody wants to chime in from Propel on here, what they can do to increase the likelihood, I would say basically talk to your rep and they can give you the right language in terms of submitting the claim to your insurance company. And it varies from company to company, but talk to your rep, Naomi, and they can give you the right verbiage. I don't submit the claims myself, so I don't want to claim to be an expert on claims. So talk to your rep and they could absolutely give you the right direction on that. Okay. We have been stating the following. How fast can you type, Naomi? Let's see. You type and we'll see. Okay, but my advice to everybody is, number one, Propel knows you're on this webinar here tonight. When they call, answer. You need to get better educated. If you want to have the rep come into your office, talk to you about pricing on multiple devices to keep the device cost down on the V-Pro, they'll absolutely be happy to talk to you about that. But either way, if you're even trying one device, it's going to pay for itself. Back to that insurance question, alveoplasty to facilitate difficult orthodontic movement. I don't know if that's the appropriate language or not. Again, I'm going to defer you to your rep, and they'll be able to give you the best language to help ensure the greatest likelihood of getting those claims accepted to you, Naomi. So I'm going to defer to the reps because they absolutely know more about it than I do. Okay, ladies and gentlemen, we are going to wrap it up tonight. Once again, I'm going to ask you to please, when your Propel rep reaches out to you, take that call, take that email, speak with them. If you need them to come by your office, they'll be happy to do that also. This is a national webinar tonight, so I can't tell you who your reps are, but they know who you are, and they will be reaching out to you. And trust me, this is a device you need in your toolkit to be successful with clear aligners. I did not get to where I am with my success with Invisalign without using this adjunct devices that help me be successful so I can stay profitable with my cases. We want to do charity work. There's a method to this whole madness here. It's great that we do charity work. We should do charity work. We're very, very fortunate the profession we're in, and it's amazing to be able to give back. But on those days and those procedures where we're not doing charity, we want those procedures to be as profitable as possible. So use the best tools you have available, use the best tools you have in your toolkit, and don't shortchange yourself. And please, please do not be drilling into the bone with your high-speed or low-speed handpieces unless you are doing it with Propel. Thank you all for coming tonight. Have a wonderful evening. Stay safe. Hopefully we're all vaccinated, getting vaccinated. And next time I see you all, hopefully we'll see each other live. Have a great night. Good evening.